This is LiveWell Talk on pregnant women and the Moderna vaccine for COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health St. Luke's Hospital. Recently, the WHO, World Health Organization, released a statement advising pregnant women not to receive the COVID-19 vaccine produced by Moderna. However, the Center for Disease Control, the CDC, has continued to make the recommendation for receiving the vaccination if you're pregnant. Returning to the podcast today to help us analyze this situation and this disparate recommendation and give his professional perspective is Dr. Stephen Pedron from UnityPoint Clinic, Maternal Fetal Medicine. Welcome back, Steve.
Hi, how are you, Dustin?
I'm well. So, we live in a headline world. Nobody reads the whole article. It's clickbait. You skim through stuff. But the WHO recently came out and recommended against pregnant women having the vaccine for COVID-19. And as we've spoken previously on the podcast, you had recommended that it is the risk is significantly less than the benefit for these patients. You want to take us up to speed on what your thoughts are on the WHO as well as the CDC recommendations, and what should we be telling our patients?
We should be telling our pregnant patients to vaccinate, period. The WHO just missed their mark on this. I think they lost their mind. Why this happened, I'm not completely sure, but I know that we're a click-happy culture, but I'm not. I'm looking at the science on this, and I've looked at every English-speaking piece of literature on the development of the vaccine and how it might affect pregnancy and how it shouldn't. And I'm just completely convinced that it's safe and that we should be strongly advocating this vaccine for our pregnant patients. Of course, it's a decision. It's a shared decision, and it's a choice from the patient. But my wife or daughter, which is the metric I use for how to make choice in this specialty, I would say in a heartbeat, get the vaccine.
Yeah, I think when you read the WHO, their bottom line was talk it over with your physician. Well, that happens on every interaction with patients. We do that all the time. I thought it was unnecessary for them to make this recommendation. They should have had a pregnant pause, no pun intended, prior to sending this out, because it just causes mistrust and panic in people that is unnecessary.
It feels like a covering your tail response to me. I'm not sure whose tail they're covering on this. I would even take it a step further on the shared decision making and discuss with your physician. I don't think that a pregnant patient needs to discuss it with their physician to go get the vaccine. Of course, do that. If they've got questions, we're here to serve. But I am confident enough of the safety of this vaccine that I would tell patients, talk to your provider, don't talk to your provider, but you want to go get it, just go get it. I'm comfortable with it.
I think one of the things I'd like you to cover is the mechanism of the vaccine and the potential for developmental delays or harming the fetus. The messenger RNA vaccine really doesn't have a mechanism to hurt, correct?
It does not. And that's a great question, because we do this mathematics on medications and treatment in pregnancy all the time. You got a patient with a brain tumor or some other type of cancer, and you need to save her life in order to get a healthy pregnancy, then you have to evaluate the medication. The same is true here. What's the plausible mechanism where this particular vaccine would hurt the fetus? There isn't any. There just isn't any. It's not that type of vaccine. There are some vaccines, live vaccines, which plausibly might, even though the data for that is scant. But this vaccine is just perfectly safe, and that I am aware of the vaccines that are in the pipeline. Likewise, though they have a different mechanism of action, they likewise are going to be safe. There just isn't any way that these vaccines could hurt the baby.
Yeah, and I think the messenger RNA model of care is something that's going to come up more and more, and people should be comfortable with it. I think you're going to see it. Well, you are seeing it in other cancer, particularly oncology. You're seeing the development of that treatment modality, and it continues to grow, and it will change. Genetics will change the future of medicine. Steve, what's your perspective just on how we're doing the situation with COVID-19 and pregnant women at this time?
How are pregnant women faring, or
what are you seeing? It's been maybe 2 months since we talked about this on the podcast.
I still think that they're doing about the same as the non-pregnant patient. There is still a lot of chatter that pregnant women get a little more sick. For sure they get as sick, and so we need to be really careful, and they just shouldn't get COVID. That's a bad deal. I'm not sure they actually get more sick. I think that we're probably just more vigilant and we treat more aggressively in pregnancy, and you're darn right that we should. How are we doing overall as far as prevention? I don't know. A lot of pregnant patients are still getting coronavirus and still causing illness, so that's bad. This misinformation about the vaccine has got to stop. I think that that's just a critical point, a critical turning point, pivot point, call it what you will. We have to get the word out that it's a safe vaccine.
Yeah, I think when back in the spring, March, February, when we were making decisions locally about to mask, to screen at the doors, to restrict surgeries, we really had no metric that was crossed that said, okay, we crossed this line, we have to have universal masking. We crossed this line, we have to restrict visitors. We just did everything we possibly could do because we didn't know what to do. So we had to do something. And what that makes it hard to unwind it, because it's not like you can drop below this metric and say, oh, okay, now we can unmask. So the vaccine is is the bookend to this pandemic.
Yeah, and since you brought that up about the beginning of the pandemic, just referent to this World Health Organization recommendation, I rely on the World Health Organization for a lot and the CDC a lot. But if you go back to the beginning of this pandemic, the CDC did not take a strong stance on social distancing or masking, and I just disagreed with that at the time. And I think that we have to use common sense and look at what's happened with this pandemic and take everything that World Health Organization, CDC, take it with a grain of salt. Our societies, the Society for Maternal Fetal Medicine, the American College of Obstetrics and Gynecology, SMFM and ACOG, they strongly endorse this vaccine. Yeah, it's shared decision making, but they say get it out there and offer it.
Well, and I think what you'll see is, in what I told you prior to the podcast, that I'd like to see as a medical staff that we develop a hierarchy of recommendations so we have some sort of structure to it. Otherwise, you had one committee or one organization recommended WHO, then you had CDC, then you had a hybrid of them, and it was really confusing in the beginning. And so I think as a medical staff, we should at least set some sort of prioritization of where we start looking for start looking for answers.
Yes, right.
And so that's coming. So, well, it's Groundhog Day. I heard he saw his shadow, so 6 more weeks of winter. But it's February 2nd. I've lived in Iowa my entire life, and there'll be 6 more weeks of winter. I'm confident of that. But really great information today, Steve. Thank you for taking the time out of your busy practice. That was Dr. Stephen Pedron, who is a maternal fetal medicine expert at UnityPoint Clinic, Maternal Fetal Medicine. For the latest on COVID-19 vaccine, visit unitypoint.org.
Always a pleasure. Thanks, Dustin.
Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.